So today we are going to, and you know what, I think if it's all the same to you guys, I might turn off the camera for this lecture. Just really not feeling it today. I usually like set up lights and everything, but I'm going to turn this off here and you guys can hear me. If I need to, for any reason, I will turn on the camera if it's helpful for us. So today we're going to talk about the determinants of health. Has anyone heard of the determinants of health before? Maybe you've learned about it in a different class, or you've just heard about it out in your day-to-day life. Yeah, Mary. Okay, so some of you have already heard of it. Wonderful. So some of these things that we're talking about may seem may not be new to you, and for others in the class this may be a completely new concept to you. For me, when I was a nursing student, it was all new, and I found that I really enjoyed learning about the determinants of health, and I found that it really sort of changed the way that I think about nursing and approach nursing. So I'm hoping that you guys will also enjoy the content today. So we'll talk about determinants of health, and then we are also going to look at health promotion, and it's really just an introduction to health promotion. You will learn more about health promotion in semester 4. Okay, so we're going to discuss approaches to health in Canada. We're going to look at really sort of our different approaches you know, over almost the last century, over the last 100 years, I would say. So what are the approaches to health that we have taken, and how did that impact us as Canadians? And then we're also going to look at the determinants of health. What is a determinant? What are social determinants of health? And when we examine the determinants of health, we're going to talk a little bit about health disparities. And then we will finish by talking about health promotion. And lastly, at the end of class today, I will talk to you guys just briefly about your assignment, in-class assignment next week. Oh, and I did mention when those of you joined the class, I don't know if you saw, just I wrote in the chat box that we can have a shorter class today if you would like. I'll leave it up to you. Again, I'd like to sort of gear the class towards your needs, but I did propose this to my students yesterday as they were sharing that they were a little bit stressed out about their test that they just completed, and so I will leave it up to you guys. We have a little bit of a module within the lecture that you guys can either break off into groups and do them together. So you do them together and come back, and then we would continue on. Or you have the option, if you would like, to do that on your own, that module. And it is about 15 to 20 minutes. So if you'd like, we can kind of we'll get started, and then I'll check in with you when we get there and see what you guys would like to do. But if you don't want to do that, then we can end class a little bit earlier. Melissa, the module is not due. It's not for any marks or anything. It's just a part of the content. It's from the CNA. So I just wanted to give you guys, like if we were all in class together, I would break you guys up and you guys could work on it together, or here, you know, since it's distance learning, I can still break you up into the groups and you guys can watch it together. It just is, I'll show you what it looks like, but it is, it's just a sort of a brief module. If you want, when we get there, we can discuss a little bit further, but I just wanted to put that out there and give you guys the option of what you would like to do. Okay. Okay. So before we kind of dive into what we're going to discuss today, I wanted to just pose a couple reflective questions to you. So I wanted to ask, how would you define the term health? We say it, we talk about it all the time, health, or to be healthy. What does that mean to you? What does the term health mean to you? Anybody want to share? You can share in the comments, or you can share with your voice. But just when you just first thing that pops in your head when you think about health, what does it mean to be healthy? Konsang says free from disease, sound body and mind, well-being of body and mind, optimal sense of well-being, Anita says the state of someone's condition. I'm just reading some of your comments. Good condition, both mental and physical state. Optimal functioning. Erin's talking about an immune system. Good quality of life. Good. So we can see there's kind of a variety of ideas when thinking about health. From Kunseng saying free from disease to sort of more some more holistic of mental and physical or social well-being. So really there's different ideas about health. And we're going to look at that, even from what you guys have just been able to kind of think of quickly as you're reflecting on that, really sort of illustrates how we as a country over the last 100 years have sort of shifted our focus and how we've defined and thought about health, how we approach health. So how can you achieve health? What are some of the things that you do to achieve health? Could be anything, big or small. Things that you do to achieve health. Exercise, yep. Nutrition, healthy diet. Those come to mind kind of right off the hop, right? Healthy diet, healthy physical activity, exercise, self-care, yep. Meditate, vaccinate. Yeah, stress-free, working to be stress-free. Great. So these are all things that we kind of work towards. Pollution-free environment. Great. That's a great one, Masara. Thank you for sharing that. Hydration, sleep. Oh my goodness, what is that? Sleep is a big one, right? We need to get sleep, and it's tough as a student, and it's certainly tough as a new mom or new parent as well. I have a 19-month-old who likes to wake up in the middle of the night every night watching and wants to watch Peppa Pig, and it's really cramping my style. I need to get some sleep. Okay, so those are some of the things that we do to achieve health. So thinking about that, what are some barriers? What are some things that prevent us from obtaining these things that we want? Injury, environment, illness, income. Yep. Darlin says age, family history. Yeah. Yep. Genetics, finances, discrimination, addiction, immobility. I'm just reading all of your responses again. Great, guys. Those are all barriers. They can all be barriers for us to achieve our sort of optimal health, what it means to be healthy for us. And that's really what we're going to look at today. Okay. So here is sort of a very, like a small snapshot of our approaches to health and what health means in Canada. So this has actually gone over a lot more in your readings. Chapter 1 of Potter and Perry. It's a great chapter. It's not very long. I really do recommend that you read it. It's a good read, I find. And they go over, Potter and Perry goes over in a little more detail each one of these sort of different approaches, but I'm just going to give you sort of a summary of each. So we started sort of with a medical approach, and that was in the early to mid 1900s. And here we have less emphasis on health promotion, but more about treating disease. So with a medical approach, we really look at the physiological risk factors, and we define healthy as being free from disease. So one of you, I think it was Kunseng, who said, when you think about health, you think about being free from illness. So basically that means that you're healthy if you're not sick. So if you don't have a broken bone, you don't have the flu or any chronic illness, you're not visiting the hospital, you're healthy. That's what this medical approach sort of looked at. And we can see it, like during this approach, it may seem limited now when we think about it. This was in the early to mid 1900s. Now we seem to have a sort of a more broad understanding of health. But it's not to say that this approach was all bad, right? There's a lot of interesting things were happening around this time. Antibiotics were discovered, new treatment plans, hospitals and sanitation practices were increased. That all happened in the medical, sort of the medical era, and with this medical approach to health. However, it is a little bit limited in that the focus on only disease, or healthy being just free from disease, it really failed to consider promoting optimal health. And some of you even mentioned about the physical and the mental aspects of health. So in the medical era or medical approach, we still have, many mental health issues. However, the approach to these mental health issues would be less holistic and more about sort of treating with the physiological aspects, as opposed to recognizing sort of social impacts that social factors that also impact mental health and health overall. So that is sort of our medical approach. Then we sort of advance from the medical approach in the 1970s. We took sort of a behavioral approach to health. And the behavioral approach, here we start to think, we look at things like lifestyle and personal choices, and we consider a patient's behavior and their choices as being responsible for their health. So the patient or the person themselves has, we believe here that they're responsible for their health. There's a big onus on the responsibility of the patient for their own health. So here we can, in this era, we started to see things like quitting smoking campaigns, exercise, promoting exercise, things like that. That sort of started to become more popularized in the 1970s, when we're looking at health in a way where we think, the responsibility is of the person themselves. Their lifestyle, their behaviors, and their choices contribute to their overall health. Okay. Then in the 80s to really what we kind of the approach we still take today is a social environmental approach. And here we look at health as being a more positive concept where we really emphasize social and personal resources as well as our physical capabilities. So in this approach here, we are taking into account not only is it, yes, the person is responsible for their health. Yes, our choices and our behaviors contribute to our health, but we also recognize that there are social factors and environmental factors that come into play that are sometimes beyond a person's control that also impact their health. Really, with behavioral, if I could say any sort of limitation of this approach, is that it sort of has almost like a victim blaming type of approach. Like, you're not healthy because you don't eat well, right? Instead of thinking that, well, maybe you don't eat well or you don't have a proper diet because you don't have access to education, you don't go to school, you're not educated about healthy choices. Your income also impacts. Maybe you just lost your job or you don't have a job, you're living in poverty, you can't buy fresh fruits and vegetables, so that impacts your health. So you can see how the socio-environmental approach takes a more sort of holistic and socially responsible approach in thinking about these social structures that exist that can cause some barriers to our achieving our optimal health. So here we start to look at a goal with this socio-environmental approach is to reduce health disparities. And one great thing that came out of this approach is really the development of the determinants of health, and even more specifically, the social determinants of health. And we're going to look at that. Is everyone clear sort of on these three different approaches? If you're thinking sort of a timeline on on how we sort of developed and expanded upon our knowledge and our approach to health? Just reading your comments, guys. Yes, Mazara, sometimes that behavioral approach still does kind of exist today, where we, you know, you put down, sometimes you feel that you're being put down to change, or like kind of being told that it's your fault that you are struggling in a certain way. And that does still happen today. And that's why we need to really sort of focus on using this social environmental lens. Okay, great. And yeah, Mary, you're right. Sometimes patients do need to make lifestyle change. Absolutely. I'm not saying either that the behavioral approach is wrong. Definitely, we've learned wonderful things by taking that approach. But by expanding on that to sort of include and make sure that we're always aware that, you know, sometimes there's more to the story than just this person needs to change what they're doing, right? Maybe it's too difficult for them for a number of reasons. And that's why this understanding of the determinants of health, which we're going to look at, can really help us be better care providers and overall hopefully improve our societal health and our healthcare systems and policies. So that's what we're going to get into now. We'll talk a little bit about the determinants of health, and then we're going to focus on health inequalities. You may hear me say inequalities. Sometimes I say, I'll write down here, disparities or health inequities. Those are some other words that I use, and it's the same, meaning the same thing, okay? And we'll look at that. Okay, wondering if I can have a volunteer to just read this quote for us for the rest of the class. Anybody? No? You guys just want to hear my voice? Cecilia, thank you. Thank you so much. Go ahead.
Healthcare system. Even the best healthcare system in the world will be only one of the ingredients that determine whether your life will be long or short, healthy or sick, full of fulfillment or empty with despair.
Yes, thank you for sharing that. So I really like this quote. It comes from one of your assigned readings this week, from the Social Determinants of Health, the Canadian Facts. And what this basically means is that we can have, we can have the best doctors, the most advanced hospitals, cutting edge technology, but that's not the only ingredient to health. We need to recognize that there are social structures that need to be in place to help our citizens achieve maximum health, right? So it's more than just having the best doctors and great hospitals and technology and medications. There's more to it than that in order to achieve optimal health. I do encourage you, actually, I don't know if, I know it was a busy week for you guys. Were you able to look at your readings? Let me just find the course outline here. So it's chapter 1 of Potter and Perry, as well as we also had the Social Determinants of Health, the Canadian Facts. Did anyone have a chance to look at that? It's okay if you haven't. I recognize it's tough sometimes. Okay, so you know what? I'm going to take a moment just to show you that quickly. I just have to look it up here. I thought I had a tab open. Bear with me for a minute, guys. Okay, I'm going to share my screen with you because I really just wanted you to look at, you know what, we'll do the next slide and then I'll show you part of your readings, okay? Because I think most of you didn't have a chance to get to it. So in terms of determinants, what is a determinant? There are lots of different determinants, but it's basically primary factors that help shape our health. So many of you were, when we were doing some reflective questions at the beginning of class together, a lot of you had kind of identified these things as barriers. So things like income, gender, culture, they all help shape our health status, and we call those determinants, okay? And we might be thinking, okay, so great, I understand income, gender, culture, those are determinants, but how do they affect our health, or why are they linked to our health? And the reason these factors impact our health is because there's a relationship between how we experience stress and how that impacts our physical and psychological well-being. If you think about someone who maybe just lost their job, what type of stress might they be feeling? So if you just lost your job, what are some things going through your head? Right? Maybe I'm worried I can't pay my mortgage or my rent, or maybe I have children to feed. How am I going to support myself? What if I can't get another job? All of those things adds and contributes to prolonged stress. And we know that prolonged stress causes physiological changes in our body, right, on a number of our biological systems. So someone experiencing long-term stress in their life may be at increased risk for negative health outcomes. So maybe they might be more susceptible to cardiovascular disease or cancers or any other illnesses because of this prolonged stress and the way that it manifests in our bodies. It has a physiological response in our bodies. And that's why these determinants, understanding these determinants, these factors that can contribute to this prolonged stress, it's important to understand them, because if we can address these determinants and diminish some health disparities or inequities, then we can hopefully improve the overall health of the population, right? Do you see how that works, how that relationship sort of works? So that is a determinant. There are a broad range of personal, social, economic, and environmental factors that determine individual and population health. And I'm sorry the slide looks funny. Sometimes when I upload, I'm sure you guys realize by now, the slides that I upload together, when we upload it on Blackboard, it sometimes looks a little bit different. But I think yours should look better than this. So some of the determinants of health include income and social status, employment and working conditions, education and literacy, your childhood experiences, right? How you grew up, physical environments, social supports and coping skills. So physical environments like where do you live, healthy behaviors, access to health services, our biology and our genetics. Some of you had mentioned before. Gender, culture, and race. So these are all the determinants of health. And then social determinants of health refer to a specific group of social and economic factors within the broader determinants of health. So within, oops, just trying to get my little pen, within the broader determinants of health. So these social determinants of health really relate to an individual's place in society. So things like income, education, employment. So you understand the social determinants of health are they're not different. They're not entirely different than the determinants of health. Determinants of health, think about as sort of like the big umbrella term. It's a broad range of these factors. And then the social determinants of health are within the determinants of health, and they're the ones that target more specifically an individual's place in society. Okay, so I think now would actually be a good time to show you that your readings. I'm just going to share my screen with you. Friendly reminder that when I share my screen, I cannot read your comments. So if you do have something you wanted to say, please speak up with your voice. Okay, so I'm going to share with you, have it here in a tab, social determinants of health. So this is one of your readings. Just before I keep rambling on here, can someone just pop on and say yes if you can see my screen?
Yes. Yes, we
Yes.
can.
Okay, great. Thank you guys. Sometimes I just need that confirmation because I've done this before where I'm like scrolling around and clicking and showing everyone things, and then I come back to the chat box and everyone's saying, we didn't see anything you were doing. So to save time, good, you can see. This was your assigned readings. I actually really enjoyed this. It's a good read. When I was a nursing student, I printed it off actually, and I kept it always just like in a binder because I would refer to it quite often, especially when writing papers or having discussions in class. So this was actually written in 2010, which seems outdated as far as literature goes for us now, but it's actually still very relevant. When I was in school, it was still relatively new. So just want to guide you a little bit. So within this document, it talks a little bit about stress, bodies, and illness. So what we were just addressing a couple slides ago, talking about, why do we care about determinants and how do they have an effect on our health? This really sort of looks at further explaining how stress manifests in our bodies and impacts our health. And then it goes into each of the determinants: income and income distribution, education, unemployment, housing, social safety net, health services, etc. So it explores those a little bit further. And the module that we're going to look at soon also looks at this. And your readings in chapter 1, Potter and Perry, goes through them as well. So it's really important to make sure we're not going to spend too much time going. I mean, it could be several classes if we wanted to do a deep dive into every single one of these. But this is an excellent document that's nicely sort of organized and easy to read. So I do recommend that you get to it when you have time. And then there was one part of it that I wanted to show you when I was reading through it again last week, that this is going to be a little bit of, one of my side tangents. Whenever I'm sort of preparing things for you guys, I often think about sort of when you graduate and what are some helpful tips for interviews and for your resume and things like that. And I know that this class isn't totally about that, but when I can share tips with you, I do like to try to do that. So I always say, put this in your parking lot, tuck it away for later. But when I was looking at this, I noticed here when it's showing the resources in the appendix, it has join the social determinants of health and communication network. Now, I just sent an email off to this. I haven't heard back yet, so I'm not sure. I want to see just what it's all about. But it says connect with, over 1,000 others from around the world who are concerned about the social determinants of health by emailing here. So you can join sort of this group. And the why I wanted to share this with you is because I thought about when I was graduating school and then I was, composing my resume. Aside from my clinical experience, which you guys will all have, I didn't really have much health or nursing related. I actually worked as a server and a bartender for many years, so that's not really what I was going to put on my resume when I'm applying to hospitals. So I was trying to think, how can I build up this resume a little bit? And you generally have a section about professional affiliations or organizations and groups you can have on there, nursing organization and groups. So I started to really, in my last year as a student, I started to really look for opportunities to get involved, like learning opportunities. So this is one example of that. If you're interested and you like this topic interests you, the social determinants of health, and you'd like to be involved, if you see something like this, you could send off an email and see if you can then become a part of this group. And then you can include that on your resume, and maybe even talk about it in a job interview. If they ask you, how do you get involved in the community, or how do you show your commitment to nursing and lifelong learning, you can use this as an example, and you can say, well, actually, I'm very interested in learning about the social determinants of health and how they apply to my own nursing practice. So I joined the Social Determinants of Health Communication Network, in which, I connect with people from all around the world so we can discuss the determinants of health, and we receive new information about the determinants of health, et cetera, et cetera. So it's something very small that you can do that I find can sort of add to your resume and your experience a little bit, and give you something to talk about in job interviews, as well as sort of demonstrate your dedication to nursing and lifelong learning. Okay, so that's all I really wanted to show you in here as part of your readings. I really just wanted you to see the table of contents so you could see how it's nicely broken down, and then I just came across that in the appendix and thought it would be worth sharing. So I'm just going to stop sharing this and we'll get back here. Okay, that's the end of my little side tangent. Hopefully you find those things helpful. I try not to do it all the time, but when I do see something that I feel is worth sharing, or you guys might feel is helpful, I will take a moment to kind of go on a tangent from our topic here. Okay, so getting back to the social determinants of health. This is your reading here, right? So this is the document that I just showed you guys, and the link for it is in your course outline. And then this is the module. This is where I was saying, so yesterday's class opted to have a bit of a shorter class, and they wanted to look at this on their own. What we can do if you want, so this goes, and let me just share my screen with you again for a second here. Share screen. I'm going to share this with you. So this is the module. So this here has introduction. I'm not sure if you can hear that. I think if I disconnect. Hey guys, can you hear me now? I disconnected my headphones so you could hear the module, and then I was just rambling on and realized I was on mute. So I'm going to go back to that. I'm going back to the module. Let me just see here. Back. CNA module. Share. Can somebody just speak up and say if you can still hear me?
Yeah.
Wonderful. Okay, so this is the module that we can either do together. I'll break you guys off into groups, and you can take the next 20-25 minutes to go
Welcome to the
together.
Canadian Nurses Association's. In this module, we'll introduce social.
It's going to go over the social determinants of health, and there's a little sort of case study where you can just, it's just a listening case study where you can sort of apply some of the things that you've learned, and it's just module 1, only module 1 we're going to look at for this purpose. But let me come back and connect with you guys. It is up to you. Would you like to do that individually? I'm going to do a little poll here. 1 minute. Okay, so I'm just going to do a poll here. If you want to, you should be able to see a poll. If you can weigh in on what you would like to do, whether you want to do it individual and finish it later. Again, if you're worried about like, oh, you know what, I'm just not good if I finish things, if I do it later, I'm never going to get it done. If we do finish class a little bit early, you can go log in right away and complete it so then you know it's done. Or if you want, I will break you guys off into groups right now and we'll take the next 25 minutes or so to go through it and then we'll come back and finish the rest of the content. So I'm just waiting for people to sort of weigh in and see. Okay. It looks like if we're going to do be a democracy as a class here, there's more votes for doing it individually and later. And looks like about 10 or 13 of you would like to do it together. So what I can suggest to sort of hopefully maybe appease everybody's taste is that we won't do it all as a class right now, but for those of you who do want to do it as a group, at the end of class, I can break you into groups if you'd like and let you do it together. So would that be okay with everybody? Okay. It is hard to please everyone, but I believe that we should be a democracy here in the class. So we will go with the majority of the votes was to bypass this module for now, and you will make sure that you can do that. I'll post an announcement to remind everybody, but to please make sure that you do it. Especially because I know a lot of you haven't had a chance to get to your readings. This is an excellent, excellent sort of supplement to that. It's going to go, you can sort of passively listen, right? It's easier to do that. You can passively listen and go through the module and get a much clearer understanding of the social determinants of health, where they actually will examine a few of them more in depth than we have the time for in class. Okay, so that will be our compromise. Sounds like you guys are okay with that, and I'll connect after class with those of you who wanted to kind of do it now in a group, and we'll see if we can facilitate that. So I did want to share that module though. It's excellent. I have it in the slides. I think next term I'll actually put it in the assigned readings to give people an opportunity to watch it before class if they'd like as well. I kind of like to give you guys sort of as many options so you can suit your own needs. Okay, so now that we understand a little bit more about determinants of health and social determinants of health, we've examined a little bit that document, Social Determinants of Health, the Canadian Facts, by Mikkonen and Dennis Raphael. And now we're going to talk about health inequalities. What were the other words that I said that we can use instead of inequalities as well? Do you remember? I'll put them on the side here. Health, yep, inequities, health disparities, health inequalities. Yeah, all the same thing, okay? So health inequalities, they can be defined as differences in health status or in the distribution of health determinants between different population groups. So for example, differences in mobility between, say, elderly people and younger populations, right? There's a health disparity. Or differences in mortality rates between people from different social classes. So it's important to distinguish between inequality in health and inequity. We have inequalities, but there's also inequities, which is the absence of systemic disparities in health that are systemically associated with social advantage or disadvantage. Okay. So we're going to look at actually some are unavoidable, so biologic variation. some are avoidable, otherwise known as health inequities. And those are things like these systemic sort of structures, social structures that we can work to change. Hopefully, the idea is like we can't change our genetics and our biologic makeup, but we can change, you know, access to healthcare in smaller communities or in rural communities. Those are things that we can work to actively change, whereas we can't change our biologic makeup. Do you see the difference? All of them contribute to these disparities that we have between maybe different individuals and populations, but some we can change and some we can't. So this is a short video that helps describe that. I'm going to try to, it's only just under 4 minutes, so I'm hoping we can watch it together. I was doing some troubleshooting yesterday because I wasn't able to get the sound on for us. So let me just see here if I can do that. Give me a moment. I'm just going to pull it up and we can share our screen and we'll watch this video together. Okay. Sorry guys, I'm just looking for the link. Okay. So I'm going to share my screen and I'm hoping that we can watch this all together. If one of you, when this starts, if you can just chime in and tell me if you can hear the volume, that would be great. Okay, give me a second here. Share screen. Okay, I'm going to hit play. Can someone just let me know if you can hear it?
Canada is a healthy nation, but not everyone.
Yeah, you can hear it. Okay, wonderful. I tried this yesterday and we weren't able to hear it, but I think it's because I had headphones plugged in. Duh. Okay, I'm going to start this over and we'll watch it together.
Canada is a healthy nation, but not everyone enjoys all the benefits of good health. These health differences are mostly explained by conditions in which we are born, live, play, and work. Also known as the social determinants of health, they include things like our income, housing, education, or job opportunities. Discrimination can make being healthy even more challenging. When some groups face barriers within these determinants more than other groups, this is unfair, and we refer to these as inequities. Some inequities may begin in the womb and continue throughout childhood and beyond. Canadian children living in communities with lower levels of education, employment, and income have lower chances of reaching their full developmental potential. Inequities continue into adulthood. For example, Canadians with lower levels of education, employment, or income are more likely to have diabetes and poor mental health. Ultimately, people with lower levels of education or income live shorter lives on average. Other social determinants also affect our health and well-being, such as food and housing. Certain Canadians experience food insecurity more than others. That means they are unable to afford the quantity and quality of food they need for good health. First Nations on reserve, First Nations off reserve, Inuit and Métis people experience higher food insecurity than non-Indigenous people. Black and Latin American Canadians experience higher food insecurity than white Canadians. Bisexual people experience higher food insecurity than heterosexual people. There are also inequities in access to adequate, affordable, and suitable housing. Recent immigrants are twice as likely as non-immigrants to live in housing that is unaffordable, too crowded, or in need of major repairs. Inequities experienced by First Nations, Inuit, and Métis populations are anchored in colonial policies and practices that included forced displacement into reserves and remote communities, the banning of Indigenous languages and cultural practices, and creation of the residential school system. Unaddressed intergenerational trauma adds to the ongoing challenges faced by Indigenous peoples. How do we address these inequities? By ensuring the conditions that support our health, such as good housing, income, education, employment, social connectedness, and access to social support, and health programs and services are equitably available to all Canadians. For Indigenous peoples, this would include addressing the calls to action as outlined in the Truth and Reconciliation Report and United Nations Declaration on the Rights of Indigenous Peoples. Doing this requires a better understanding of the current state of health inequalities in Canada. This information is now available in the Key Health Inequalities in Canada report and the Health Inequalities Data Tool, so that together we can create opportunities for all Canadians to enjoy optimum health and well-being.
Okay, I'm going to bring us back to the class here. Stop sharing that. Okay, so we're back. So how did you feel when you were watching that? Or were you aware of many of these health disparities before? Or some of them new to you? Yes, so a lot of you are aware of them already. Yep. Okay, good. I'm glad that there's some sort of awareness of this already. I definitely feel like as a whole, we're moving in a direction of being more socially conscious, which is great. And so really, I think, sometimes I'm watching, even if I watch like the news about what's happening in the States a lot or things about Black Lives Matter, I think, oh my goodness, I'm so happy we live in Canada and it's not as bad here. It's like, really though, we have a lot of things that still definitely need to be addressed here. There's still a lot of inequities. And I think actually I should take a moment to go back here, and I kind of lumped these all together, and I do want to differentiate a little bit so it's not too confusing. So health inequalities, because you'll hear all of these being talked about together. So health, I just want to clarify a bit more. So health inequalities is like the differences between two different groups, right? So as I mentioned before, mobility between older people and younger people, there's an inequality or a disparity there between the mobility. But, the mortality or rate between people in a high class social class versus a lower social class, those are also inequalities, right? There's a disparity, there's a difference there. But because those are something that is avoidable, they're known as inequities. It's something that we can change. We can't change, the differences in mobility between a teenager and a 90-year-old. That just happens biologically, right? We can't change that. There's nothing we can do about that. But it's still a difference, a disparity. But we can change, access to healthcare or a lot of the other determinants that impact the health of people living with a lower social status. Does that make sense? So those are inequities. And our goal is for health equity. So we want to eliminate those systemic disparities. I hope that further clarifies. I realize that it's kind of seems like I just kind of made them all exactly the same when they're not quite exactly the same. Okay, good. So yes, so there's still a lot that needs to be done here, even in Canada, right? There's a ton of different health disparities, health inequities that exist, and these determinants play a huge role. So as that video said, it's important for us. The first step is the understanding, having a broader understanding of how these determinants impact the health of us as Canadian citizens. So how are they interplaying into our health more specifically? Because us as nurses, we're in a key position to sort of help eliminate those health disparities and work towards our goal of health equity. But it's all started having a broader, a greater, I should say, understanding of these inequities and how all of the determinants interplay in our lives. So that's kind of it about the social determinants that we'll discuss, aside from the module that you do in your readings. And I find that, you know, when I was first learning about the social determinants of health, I left feeling the class feeling like, oh, like this is overwhelming, and like I feel defeated. So, you know, it's okay to feel sort of that sense of overwhelming and negativity, because, you know, there is things that can be done. There is a silver lining. There are strategies in which we can engage to sort of help lessen and hopefully eradicate some of these health inequalities and inequities. And health promotion is one of those strategies. So again, we're going to talk about health promotion here very briefly. It's just an introduction to health promotion. You will learn more about health promotion in semester 4. In semester 4, you're going to learn about community nursing, so you'll explore a little bit farther, a little bit more in-depth health promotion. And in your assigned readings, they start talking about health promotion on page 11 of Potter and Perry. I'm wondering if I can have a volunteer read this quote for me, how health promotion is defined. Any volunteers? No? Okay, I'll read it then. I get it. It's a Friday. Cecilia, again, you're coming to save the day. Thank you, girl.
Okay. So activities directed toward increasing the level of well-being and self-actualization. The focus is on enabling people to increase control over and improve their health.
Great, thank you. So really, it's looking at ways that we can sort of empower the individual to be able to increase their control over their own health. So remember when we talked about those different approaches, right at the very beginning of the term, we kind of looked at a timeline of our approaches to health. Health promotion really sort of spawned out of that behavioral approach in the 70s when we started to approach health from that perspective. So again, each of those, when we went through that timeline, you know, they all sort of serve a purpose in contributing to advancements in how we approach health. So what can you think of in terms of some examples of health promotion? Often it involves education. So can you think of any examples of health promotion programs that maybe already exist, or even just in more general terms, maybe something that health promotion targets? If someone were to ask you, you know, what is health promotion? Yep, Danielle, falls prevention. Yeah, falls prevention can be a type of health promotion. Yep, Belle, let's talk for mental health awareness. Group therapy. Yes, yep. The Canada Food Guide, right? Canada Food Guide is an example, right? Empowering people to sort of, it's a quick way to educate people on how to eat balanced meals. Yep, promoting child and family nutrition. So I'm just gonna write a couple down. Canada Food Guide. You have, what else? What are some of the other things you said? Belle, let's talk. Yeah, that's an example. Yes, endurance, sex education in school. Great. Yeah, Farah, SIDS prevention education. Does everyone know what SIDS is? Sudden infant death syndrome, SIDS prevention, prenatal and postnatal. Say postnatal education. Yeah, so Alcoholics Anonymous groups, their support groups are a little bit tricky because they are, yeah, they are sort of still health. I would say they would still fall a little bit under health promotion. But definitely sort of even before it gets to that point of substance abuse, understanding, so education around the use of different substances as well is more health promotion. So those are a couple examples. I even had, so the Toronto Public Health does a lot, especially around sort of, as who was it? Was it Farah? Was mentioning about SIDS prevention and education. So there is, I'll share my screen with you again. This one here, I pulled up just a couple of these programs. So this is from Toronto Public Health, but Ontario Public Health does it as well. There's programs like Healthy Babies, Healthy Children, where they do home visits. There's online training for new parents, one-on-one nutrition programs. These are all examples of health promotion activities, right? So we're geared, again, it's often focused around education, and we're trying to empower, in this case, new families, trying to sort of empower new families to be able to take control over their own health and their family health by having this knowledge about how to care for a newborn, that can help increase their health outcomes and create a healthier family and healthier baby. So that is some of the examples. Great, you guys were able to identify quite a few, but there's a ton of different health promotion examples. And I just really want you guys to understand what is health promotion, so that as you move through, your own careers and through the program, you can start to identify these things that are examples of health promotion and understand why it is that, what's the goal, what are we trying to do, right? We're really trying to enable people to increase the control over their own health so they can have better health outcomes. Oops, I went too far. So now we're going to talk about disease prevention. They kind of go, disease prevention and health promotion kind of go hand in hand. It's talked about on page 11 of Potter and Perry. There's 3 levels of disease prevention. There's primary, which really focuses on protection against disease, and that's before signs and symptoms have happened. So primary is protecting against disease before any signs or symptoms have occurred. Secondary disease prevention is activities that promote early detection. And tertiary is activities directed towards minimizing disability from the disease and helping patients learn to live productively with their new limitations. So primary would be things like immunizations, right? So annually we often get the flu shot. I don't have the flu, but I'm hoping to protect against getting the flu. Don't have any signs or symptoms of the flu. So that's primary. I'm trying to prevent getting that illness. So immunizations. Other examples of primary is activities targeted at reduction of risk factors. So things like could be like anti-smoking campaigns, like quitting smoking, campaigns about reducing inactivity, right? So getting people to be more active. Those are primary disease prevention activities. Secondary, as we talked about, they promote early detection. So that we want to get this early detection so that we can get prompt treatment and can be, or we can maybe halt the disease. We can either start treatment right away, or we can maybe stop the disease. So what do you think would be some examples of secondary? Yeah, Marvin, screening. I don't know, I just went back to the comments. I don't know if you said that before, but screening. So things like Pap tests, right? Women get Pap tests once every 3 years, and we're looking for precancerous cells in the cervix. Mammograms, yes, Catherine, that's right. So mammograms, testicular self-examination, colonoscopies, right? A colonoscopy is where they put a camera in your colon and they look for polyps and any precancerous cells, so that we can remove the cells, right? So these are secondary. Yeah, Marvin, general physical exams, right? If you go for an annual physical exam with your general practitioner, that's an example of secondary. Okay, we're trying to detect an illness early, doing these activities so that we can detect an illness early and then either start treatment right away, or we can halt the disease, hopefully, by removing cells or whatever it may be. Yeah, Marvin, I would say, oh, a biopsy. A biopsy, Farah, yes, a biopsy would be included. That's a type of sort of screening. And a biopsy is where they take a little, like a pinch of tissue. So often for, trying to think examples of my own practice when we do biopsies, we do kidney biopsies, and I do biopsies of the bowel. So like for patients who maybe have inflammatory bowel disease, like a Crohn's or colitis, they would do a scope, and then Marvin, they take a biopsy by pinching a little bit of tissue from the colon and sending it off so they can then examine what's happening. Okay, so those are your secondary. And you see the difference, like primary is before any signs or symptoms occurred. So like a vaccine, right? I'm not trying to detect the flu and stop the flu. I'm trying to prevent the flu from happening by giving this vaccine well before signs and symptoms have occurred. Secondary is I'm now trying to actually detect. I just want to make sure that I can detect an illness early so that I can start to treat it or maybe remove it right away. Okay, and then tertiary, those would be things like, so the patient already has the disease or illness, and now we're thinking like, what can we do to help them live their best lives with their new limitations? So an example I think of for tertiary would be like a rehab program for a patient, let's say a patient who had a stroke and they're recovering, they have right-sided paralysis after a stroke, and now they're in a rehab facility to help them improve, learn how to use their left side and learn how to do the things that they used to do before their stroke. So that is tertiary disease prevention. We're really just, the person already has the disease or illness and we're trying to help them live their best life with their new limitations. Is that clear on these three? We're going to look at some examples on the next slide. Okay, so here we have the 3 levels of disease prevention, or examples, different examples. So let's start with the first one. We have cardiac or stroke rehabilitation programs. I just talked about that. So what would this one be? Primary, secondary, tertiary? Yeah, tertiary, right? The patient already has the stroke and we're trying to help them live their best life with these new limitations. Okay, support groups that allow members to share strategies for living well. What do we think about this one? Danielle says primary, Miriam says tertiary, and you're both right. So this one could be argued both. I'll say tertiary or primary. So it could be like, it would be more tertiary if it was, say, support groups to allow members to share strategies for living well with cancer, right? So they already have an illness. Or if it's just like a general support group about living well, not really specified around a particular illness, that could be more primary, right? So this could be primary or tertiary. And some of them, like I wanted to share those examples because some could be more than one, kind of depending on the specifics of the situation, and that's okay. For testing purposes, I often find whenever there's gray areas, students always wonder like, oh my goodness, what if I was asked on a test? I wouldn't ask you one of these like sort of gray area ones without giving you like more information, okay? But great, you guys were able to identify that that's primary or tertiary. This one here, vocational rehabilitation programs to retrain workers for new jobs when they have recovered as much as possible. What would this one be? Tertiary, great. Tertiary. Regular exams and screening tests to detect disease in its earliest stage, mammograms to detect breast cancer, for example. Yep, secondary, good job guys. Oops. Secondary, okay. Daily low-dose aspirins and or diet and exercise programs to prevent further heart attacks or strokes. What do we think about this one? I see some secondary, tertiary. Yep, it's tertiary because we see that we have further to prevent further heart attacks and strokes. So we're assuming that there's already been heart attacks or strokes. And this is activities that we're doing to help these people live sort of their best lives. It could also be primary if it didn't have maybe further, if it was just these diet and exercise activities to prevent heart attacks and strokes, that could be primary as well. It's one of those ones similar to the support groups up here. But because it says further heart attacks and strokes, we can kind of infer from that this group of people that we're targeting here has already had heart attacks or strokes. In that case, it would be tertiary. Okay, suitably modified work. So injured or ill workers can return safely to their jobs. What do we think about this? Modified work. Yeah, tertiary. Okay. Legislation and enforcement to mandate safe and healthy practices, e.g. the use of seatbelts, bikes, and helmets. What would this one be? Yeah, primary. Right, we talked about primary as not only, obviously, like whenever we hear immunizations, you think primary, but also the reduction of those risk factors, right? So the examples we gave earlier was like quitting smoking campaigns, campaigns about increasing activity, being more active. This is like a safety campaign. So we're trying to prevent an illness or injury in this case that hasn't occurred yet. Education about healthy and safe habits, eating well, exercising regularly, not smoking. What would this one be? Yeah, also primary. And then lastly, immunizations. Primary. Great. Good job, guys. So it looks like you have pretty good understanding of how to identify those different disease prevention strategies. I'm actually just going to share a link with you in the chat where I got these from, and then there's actually a little more information if you feel that this was still a little bit unclear for you. It also is discussed in Potter and Perry. But hold on, give me a moment here, and I'm just going to bring up the a link for you. There we go. I'll share this in the chat. Again, if you're looking back ever at the recording, you should be able to access these links in the chat. Oh, if it will let me copy it. There we go. And I'm just going to plug that right there for you guys. So there's a link from where I got these and a little bit more information if you would like. Okay, and now we're going to look at 5 health promotion strategies. And these really came from, again, sort of in the behavioral, if we're looking at our timeline, when we had our behavioral approach, really they respond from out of that. And it came from the Ottawa Charter. They identified, so a lot of different charters and acts were enacted during the behavioral sort of era of our approach to health. And the Ottawa Charter identified 5 broad strategies. I'm just writing it down here to enhance. Okay, so that's where these came from. So the first one is build healthy public policy. So building healthy public policy really involves around like advocating or focusing on policies that create healthy living conditions. So an example would be, actually an example is happening right now. The RNAO is doing this now. They are lobbying and advocating during the pandemic for safe working conditions for nurses. So that's an example of health promotion strategy. The one that falls under build healthy public policy. So it's really when a nurse is trying to persuade decision makers to adopt the healthiest options. And then they follow up and make sure that those policies have been put into place. And then the second health promotion strategy is creating supportive environments. That really looks at sort of helping to ensure that our physical environments are healthy and safe, and that our living and working conditions are stimulating and satisfying, and that all leads to better health as well. So an example of creating supportive environments is the Comprehensive School Health Initiative. I'll type that here in case you wanted to look up more about it. Comprehensive School Health Initiative. In which they look at focusing on improving school environments by providing like different health instruction, social support, and positive physical environments. Oh, and sorry, Fanis, I see you wanted me to repeat the example about the first one. Melissa typed it out there for you. So that the example is that right now the RNAO is lobbying for safer working conditions. Really, it's when nurses are, back to the build healthy public policy, is really when nurses are trying to persuade decision makers. The third one is strengthen community action. And that's where communities themselves identify issues that are important to them, and then they work together to make changes that will enhance their health. So an example I can think of for this strengthen community action is here in Toronto, we have community gardens, right? So community co-op gardens. And so we recognize, like as a community, if you live downtown, you know, a lot of people live in apartment buildings. They don't have access to a yard, certainly not enough space that they can maybe build a vegetable garden and access and grow their own food. So in Toronto, we have a lot of different co-op community gardens in which the community keeps up themselves. And they tend to the garden and plant things, and then people in the community can access the food, fruit and vegetables there. So that would be an example of strengthening community action health promotion strategy. Then there's develop personal skills. And that strategy helps people develop their personal skills and enhance coping skills, and really to just gain control over their own health and their environments so that they can make healthy lifestyle choices. So that would be an example of that would be you know, in community centers where we have maybe English as a second language courses for people who have newly immigrated, career workshops that are for free in community centers, even some of the things we talked about, the prenatal programs, teaching for healthy babies, healthy children. Those are all helping develop personal skills. And then the fifth health promotion strategy outlined by the Ottawa Charter is to reorient health services. That strategy really shifts sort of the emphasis from treating disease to improving health and making the healthcare system more efficient and effective. So an example of that would be so advocating for more primary healthcare clinics in, say, rural areas. Or just even creating more primary healthcare access in general. So people all have access to, say, a general practitioner that they can visit as opposed to visiting the hospital. That is more efficient, and it really sort of helps, what's the word I'm looking for? It helps sort of gain access to people. It helps broaden the access to healthcare providers for people. Because if you live in a rural area and the nearest hospital to you is 3 hours away, you can see that there would be some health disparities for that particular community. So those are the 5 strategies in a nutshell. We really just kind of summarized a quick overview of them. But yeah, I would advise that you look at the Ottawa Charter of Health. It's talked about in Potter and Perry as well. Any questions about those strategies? No? Okay, let's see what time it is. It's 2:25. Really, I'm just going to wrap up by sharing a couple different links with you so you can further explore some health promotion activities and initiatives that are happening in Canada. There's various government agencies and even non-governmental agencies and organizations that exist, which focus on public health and health promotion. And they go from municipal to international, and all of these levels engage in health promotion strategies. I mentioned before, there's so many health promotion strategies that exist. So I'm hoping now that you understand sort of what is a health promotion strategy, and you have an idea of a couple of ones that are relevant to us in Canada, that as you work through the program, you'll be able to further identify these different health promotion strategies. And even in your future careers, probably work on developing these types of strategies. So I'll show you a couple. I thought that it's relevant to share these links, especially right now during the pandemic. It's really important that we know where to get information, where we know where to get the right information. What I mean by that is that, you know, the information that we're getting is evidence-based and it's from reliable scientific sources. Okay. So the first one is the World Health Organization. The World Health Organization's mandate is better health for everyone, everywhere. So they're an international organization. And if you click the link here, they do cover a lot of information about what's going on right now globally in terms of COVID-19, as well as, you know, aside from the pandemic, the World Health Organization is highly involved in many health promotion initiatives around the world, specifically looking at diminishing some of the global health inequities that we see that impact us as global citizens. So the World Health Organization is one great resource. Then if we are moving down from an international to just our federal agency, is the Public Health Agency of Canada. And the Public Health Agency really focuses on preventing disease and injuries, promoting good physical and mental health, and providing information, as I said, to support informed decision making. So as nurses, we access this I would say definitely Ontario Public Health and the Public Health Agency of Canada quite frequently to get our information, especially when something's occurring like the pandemic right now, or any other sort of epidemic, health epidemic that we may be experiencing. And then on a provincial level is the Public Health of Ontario. So Public Health Ontario provides scientific and technical advice and support to clients working in government, public health, healthcare, and related sectors. So this is our provincial. And they have great information about COVID too. So this is where you would go, like right now, as we're learning about what's happening as restrictions are lifted. And when we're moving back into sort of our color-coded system of lifting restrictions, you can find a lot of information on Public Health Ontario on what that looks like per region or by region. And then our municipal level example is Toronto Public Health, and they promote the health of Toronto residents through the delivery of health services and programs and the development and implementation of public policy and practices. So what I was sharing with you before about when we were talking about examples of health promotion, and I showed you the pre and postnatal examples, that was all from Toronto Public Health. So that is it. So that's all I really wanted to share with you, a couple more resources to explore. And really, this was just a brief introduction, as I mentioned, to health promotion. You're going to see more of health promotion in semester 4 when you learn about community nursing. But if this type of thing excites you, like if the social determinants of health, disease prevention, health promotion, public health, if all of this excites you, you might want to consider a career in public health or in community nursing. So I know you're only at the beginning of your nursing careers right now, but as you work through the program, there will be, you know, different things that sort of spark your interest, and just take note of those things because it will help you sort of develop your future career goals and maybe guide you to where you want to, what area of nursing you'd like to work in.